Welcome to Beyond the Script, a beacon for health equity, a weekly prescription for truth, mixing medicine, justice, and bold conversations. I'm your host, Dr. LaTrice Snodgrass, the CEO of Beacon Charitable Pharmacy, author and lifelong advocate for the underserved. Each week, we shine a light on the people and practices transforming how healthcare shows up in our communities, from medication access and mental health to policy, poverty, and purpose. Because here, we go beyond the prescriptions and policies to get to the heart of what really heals. This is Beyond the Script, where medicine meets mission and justice gets the mic. This episode brings us home to Beacon Charitable Pharmacy. I'll share how Beacon became more than a pharmacy. It's a place where compassion meets care and access becomes advocacy. We fill prescriptions, but we also fill the gaps left by an unequal system. This is the story of how medicine became a mission. So today I have my friend Megan here with Home Place Creative that's gonna interview me because we want to talk a little bit about Beacon. So I'm in the other chair today.
We do, LaTrice. I am so excited to hear you talk about Beacon Charitable Pharmacy. So let's start at the beginning. Beacon Charitable Pharmacy has become a lifeline for thousands of people across Northeast Ohio. Take us back to the beginning. How did Beacon's story take shape?
Yeah, so back in 2002, Carol Rizzoletti, who was the prior executive director and founding executive director of Beacon Charitable Pharmacy, she and other community members became aware that there was this huge gap. Folks couldn't get their medicine. If they didn't have insurance, they couldn't get their prescriptions. They could go to the doctor, they can go to the hospital, but not get their medicine. So Beacon was founded basically in the basement of Temkin Mercy Hospital. Sisters of Charity, Austin Bailey Foundation, and Temkin Mercy Hospital came together to fill that gap. So back in 2002, this is when Beacon was founded. In 2004, they were incorporated. And we've been in the community thriving ever since.
That is amazing. And for people who may not know, Beacon is the only nonprofit charitable pharmacy in Northeast Ohio. So how does your team translate that mission of access and equity?
Yes. Okay, so we have a small but mighty team. We have a full-time pharmacist that is registered with the Ohio Board of Pharmacy, and we have 2 part-time pharmacists. They're registered as well. We have a couple pharm techs, a community health worker, a pharmacy assistant. So we have a team of 7, 3 of which are part-time, and we serve over 800 people a year. Over 24,000 prescriptions are dispensed, valued at more than $4.7 million. So yeah, so we're more than just a pharmacy. We are like that community resource. So we screen folks for other social determinants, food, housing, transportation, and we try to connect folks with those resources that they need. So we're a connector, a convener, and not just dispensing of medication, providing that education. So it's compassion. Yeah. You know, we have compassion for the folks that we serve, which makes us go that extra mile to not just give them a script, but give them that level up that they need to get those other things that are lacking.
And why is that important? When we talk about access and equity, what you described is you play a part in that puzzle. But why is it important that why is that connection so important? Yeah.
Because it's I talk about the hub and the spoke on the tire, right? So you have healthcare, you have education, jobs, health. And if one of those spokes is broken, the whole ecosystem is thrown off. Yeah. So just simply giving a person a prescription, that's not going to help them thrive. So for me, it's important because I want folks to thrive. I often say transactional versus transformational, right? So it's transactional to fill that script and give them that script. The transformation comes when we look at the holistic approach to a person being able to thrive. And so that's why connections and that equity is very important.
So I think it's also important, and when we have these conversations, Beacon is doing such transformative work, but there's a lot, I'm sure, that happens behind the scenes to sustain this work, to help build this out and give people in the community that transformation. So can you walk us through what that looks like?
Yeah. So absolutely. So let me just talk about the structure of Beacon Charitable Pharmacy. So let me go back. Sourcing of medications, right? So there is something that is called the Ohio Drug Repository. It's not a place, it's more of a concept. And what that is, it enables hospitals, pharmaceutical companies, and nursing homes, other agencies and organizations that have medication. If that medication is not expired, they can donate that to Beacon Charitable Pharmacy. So let me give you a scenario. A person has a hip replacement, so they have to go to a nursing home for rehab for a month. And they were prescribed a particular medication. And they go home and there's still excess of that medication and it's not expired. That can then be donated to Beacon. Hospice patients, when folks transition and they have medications that have already been prescribed, you can't give them back to the pharmaceutical company, so those can be donated to Beacon. So that is how we source 90% of our medications. So our medications are donated from this Ohio Drug Repository. Then there is a small segment of our medications that we do have to purchase because some of the higher demand medications like insulins, Eliquis, medications of that nature, we purchase some of those to fill that gap. And then there's companies, how can I explain it? They're like middlemen. They get medication from Big Pharma and then they put that back into the hands of charitable pharmacies. Okay. So there's rules and regulations, compliance issues where we're able to get that medicine from them for free. So that's how we get our medications. Then we're 95% grant funded. So 90% of our revenue is from grants. So we are heavily reliant upon grants and philanthropic efforts from other donors and community members. So the funding piece is like a huge component of that back end, right? Okay. Because if the funding isn't coming in, then we can't keep this engine going because we have certified staff members because we are just like your CVS or your Rite Aid. We're licensed by the Ohio Board of Pharmacy. So we're held to strict compliance and credentialing measures. So funding is huge. Now, when that medication is donated, it doesn't come in pretty and packaged in the bottle like you get from the pharmacy. It comes in boxes and garbage bags, and it's just all. And when I say garbage bags, don't think dirty.
We know, like
just for packaging.
Bags.
Plastic bags, right?
Yeah.
So then we have to go through those bags and sort that medication alphabetically, then by medication, then by strength, then by expiration date, because we don't dispense anything that's expired.
Right.
So volunteers are huge. We probably have over 300 volunteers that come through a year because we have to sort that, then we have to log it into the computer, then we have to get it onto the shelf. Then we have to inventory it to make sure we're pulling expired meds off. So it's a well-oiled machine, but it's a lot on the back end to make sure we get that medication into the hands of our community members.
Yeah, that's huge. Thank you so much for explaining. It's fascinating. No, it really is interesting that it's taking something that would just be thrown away and then using that to collectively help all of us. So the data, and that tells us one story. LaTrice.
Right.
Do you have any human stories of impact? I mean, yes, I'm sure you have many, but any that you would like to share with us today?
Absolutely. And this is huge, Megan, and thanks for that question because that, we think about that quantitative component, the numbers, how many scripts, how many people, but that qualitative piece is the heart of Beacon, right? So one story that really resonates with me is we had a young man, early 50s, that came in and he was working a full-time job and then that job went part-time. So he lost his medical benefits and he had been without and he was diabetic, a bad diabetic. So he had been without his medication for several weeks, maybe even months. His A1C was a 16. And just to put that in perspective, normal A1C is 7.
Oh, wow.
Yeah. So we were able to get him his insulin, get him his other medications to support his insulin. And within 6 months, his A1C was a 9. Right? Yeah. So without Beacon, he could have ended up with amputation, diabetic coma. It could have been really, really bad for him because his numbers were just that high. So that's the difference that Beacon makes. That's the difference that we make, you know?
Yes, absolutely. And this leads into the next question, I think, beautifully. You talk about health equity being a justice issue.
Yes.
So not just a healthcare issue. Can you talk about that
Yes,
more?
it's definitely a justice issue, right? Because it is criminal that people cannot get their medication.
Thank you for using that language, because I totally agree.
It's criminal, right? So
Yeah.
when we talk about justice, it's creating equitable spaces so that everyone can have what they need to thrive, right? So Megan, you and I, we need different things.
Yeah.
So we've always been taught since childhood, equal, be fair.
Yeah.
Equality. Everyone should get the same. Don't treat people differently. It's bad to treat people differently, but it's not. You have to treat people differently. If you and I both go to the doctor and they give each of us the exact same thing, one of us may not be able to thrive because I may need more. And if I need more, that's okay. Give me more.
Yeah.
Right? And so I think that we have to move into the space where we're okay with saying some folks just need more. And it is okay to treat people differently. It's okay to treat people differently based on race because as an African American female, indicators for me are different than you.
Yeah.
So you have to see me as an African American female and treat me accordingly. You know, socioeconomically, you know, folks are disadvantaged. If I don't have electric or a house, giving me insulin is pointless because it has to be refrigerated.
Yeah.
Right? So you have to think, what does she need because she is unhoused? So how do I help her? Right? And that may be paying my electric bill.
Yeah.
That may be coordinating with an organization that has housing. Right? So that's why justice is important because when we think about justice, we think about doing things from a different lens, doing things differently so that people can be okay.
Thank you.
You're welcome.
No, that brings me back. This is making me think about a question you asked or we talked about earlier.
Okay.
But the importance of collaborative partnerships.
Yes.
So the idea that you are, when you yourself are serving people here at Beacon, you're looking at them with that lens, right? How can I help you in these other areas?
Right.
But how important are those collaborative partnerships to Beacon, and how do you pick the right partners?
Right. They're essential.
Yeah.
It's a must, right? If we continue to operate in silos and in bubbles, people are going to die. And I know that seems really extreme, but it's true. People will die, right? So collaborations are very, very important. And the way that we pick them is because we ask certain screening questions. And then we collect that data. And I'm able to see 15% of my people are telling me that they have more month than food. You know, 20% of my people are saying, I don't have reliable transportation. So I take that data and then I say, who in community can fill these gaps? And then those are the folks that I go after for collaborations. Workforce development, that's huge because I have people who want to work. They're not working right now. I lost my job and, you know, I'm really trying to get back out there. So then I would go to the Urban League because I know they have workforce development programs. When people are saying my electric is off or I don't have utilities, and I go to Stark County Community Action Agency because they do that. The food bank is huge because folks are food insecure.
Yeah.
So just looking at making data-driven decisions, like talking to the patients, getting patient surveys, asking the right questions to understand where those voids are at. And we are resource rich and connectivity poor. So 9 times out of 10, the resources in this community, we just got to connect the people with it, right? So instead of me saying, man, people are food insecure, so I'm going to start a food pantry. There's 900 food pantries in our county, right? So I'll refer, you know, make those relationships.
I know we've talked about this in other episodes too, but as a leader, so you just went right into this question, but sometimes as leaders, we often operate in our own silos,
We do.
you know, and so that prevents us from this collaborative approach. But you, and what you're telling us and what you've done here with Beacon, I see a leadership approach that is using some business acumen, but also a lot of heart. So what advice would you give to leaders, maybe someone out there who wants to start that nonprofit, or maybe they're in it and they recognize, they're like, oh no, LaTrice, that's me. What do they do?
Yeah. So I think that we have to be really, really mindful of duplication of services, right? Because most nonprofits are grant funded. And if we have duplicative services, then we're watering down the little bit of funding that we do have. And this is hard, right? So you talk about heart and the business piece, right? So I may have a passion for this thing, but if that that need for that thing is already being met, then I need to be able to say, how do I collaborate and support? And it's hard because like your budget is your budget, right? And you have to make ends meet. So sometimes people don't want to partner because now I may be cutting off my nose to spite my face because they're going to get this funding.
Yeah.
But when we're passionate about things, my advice to a person is to be passionate enough to do the right thing. Right?
Yeah.
So do your research and see, is that need already being met? And if that need is already being met, how can I help the organization that's doing it? If that need is not being met, my advice is make sure you have your business case in order. Make sure, this is something else. Don't do anything for me without me. Right? So I may be very passionate about something, but if I haven't talked to the people that I want to put this in place for, then I'm doing a disservice, right? So a lot of times I hear people say, man, this service is here and people just don't come. Well, because they don't want that. You wanted that, right? So you feel better about yourself because I got this bright, shiny thing here and I'm going to help all these people. And people are saying, I don't need that. I don't want that. We don't talk to the people. So talk to the people that you feel like you want to help and get their insight. Let them help you build it. Talk to them about where they having that need met at now. What is the gap? Why is that thing not meeting their need? Right? Do your research, and that research has to include the population that you're wanting to serve.
Absolutely. And you've done that here at Beacon. So there's also some new chapter coming here, right? So you are going to be offering things like medication therapy management. Can you talk us through, okay, we've heard you are listening to your population and that is helping you also offer new services. So tell us more about that.
So medication therapy management, in essence, that is a comprehensive medication review with an action plan that comes behind it. So let me break it down. So we have a lot of our patients, unfortunately, have to use the emergency room as their primary care doctor. Many reasons, right? We instantly go to judging. Well, why don't you just go to the doctor? Well, maybe I work a job that's 9 to 5. That's the hours that the doctor's office is open. And if I take off work, I get points. If I get too many points, I lose my job. So I have to go when I get off work, which forces me to the ED. Or I don't have insurance. Well, the hospital, if I go there, they have to see me. A doctor's office, not so much. So a lot of our patients use the ED as their primary care doctor. So what happens is, and they don't have insurance, so you get lost in the sauce. So when I go to the doctor, because I have insurance, any medications that I'm on, my doctor will get an explanation of benefits from my insurance company that says the medications that I'm on. They can be tracked through claims. Well, people who don't have insurance, it's not on the radar of a doctor because they're getting it from us and we don't bill, right? So we have patients who are on lots of medications, and unfortunately sometimes a person can be on Coumadin because let's say they went to this heart, it's a blood thinner. So they went to this heart doctor and they gave them Coumadin. Well, they ran out, so they went to the ED, and now the ED gave them warfarin, same medication, just brand name and generic, and they're taking both.
Oh, no.
Right? So imagine taking 2 blood thinners. So through these comprehensive medication reviews or medication therapy management, our pharmacists can detect that. Right, and tell you, oh no, stop, this is the same medication. Or a patient is on insulin and they're taking a particular supplement, and sometimes supplements do things to medications that you don't want them to do. So there are certain supplements that can slow down the way that your insulin metastasizes in your system, thus making it less effective. So these are things that our pharmacists are finding. When your blood sugar level drops, the wrong juice, grape juice, will spike your sugar, right? So in talking to our patients, we're able to understand some of the things that are making medication adherence not so optimal. Right. So that medication therapy management is huge. And then what happens is after the pharmacist goes over all of your medications, they give you an action plan. What is one thing you're going to do that can help? Are you going to take a daily walk or, I'm going to stop smoking? Like giving you an action plan and then following up with you and then communicating with your doctor to let you know what we've discovered. So medication therapy management is huge.
I wish all of us could have medication therapy management, LaTrice. I think
Right.
that would benefit everybody. But what a wonderful idea. And throughout this interview, I have just hearing you speak, you have taken, and that's another episode, but you have taken, your life story and turned it into this beautiful calling, justice.
Yes.
So can you talk more about that calling and why leading Beacon Charitable Pharmacy means so much to you?
Yeah, it's personal, right? Because, I grew up in subsidized housing, on Medicaid, food stamps, not having everything that I needed to truly be able to thrive. So I've sat on the other side where people have talked at me and not to me, where my concerns are dismissed, where I may not be able to get a test that I need because Medicaid won't approve it, even though the doctor is saying that I need it. It messes with your self-efficacy. And people are caught in a vicious spider web of poverty. So if the deck is stacked against me already and I'm sitting before a medical professional, just one little thing will send me over the edge. Right? So compassion in healthcare is so important to me because I've lived the lack of compassion in healthcare, right? And I understand that healthcare has to come outside of the four walls of our buildings. Healthcare to be successful has to be a partnership between health systems and community-based healthcare, which is why Beacon is so important to me. So I spent over a decade of my career in big hospital systems. And grant you, folks are doing the best that they can because there are so many forces that play a part in how a doctor can administer care and how a system has to work. No margin, no mission. But what happens is that causes people to fall through cracks, which is why I had to get out of hospital care because for me, it didn't meet the core calling of my life.
Yeah.
So community-based healthcare is something that I moved into back in 2017. So when the opportunity for Beacon came up, I have a sorority sister that was on the board, and she called me. She said, the executive director is retiring, and we're looking for a new person. I said, I'm not a pharmacist. And she was like, well, neither is she, so it's okay. And I'm like, okay. So I prayed on it, and I decided to apply for the position because I knew the difference that Beacon could make in the lives of people. Getting the word out that Beacon is here. Still, every month I talk to people, and they're like, what is Beacon? Like, well, it's been around for like 20 years. Like, it's not new, right? Yeah. So being able to connect with people, I am naturally a connector of people. And it's funny because we interviewed Mike Galena, and you'll hear from him a little bit later in one of our episodes, but he worked with me on our strategic plan, and he kept saying, okay, LaTrice, you're and he's the greatest guy, best heart ever. LaTrice, that is really great. Your passion is shining through, and I think it's phenomenal. But is that mission creep?
Oh, yeah.
So basically, you can't do that.
That's a good point, though, for people like you that have a strong calling and, like you said, are already natural connectors.
Yes, like I'll have us selling baby dolls if you don't rein him. Like, we can sell baby dolls. People like baby dolls, and people that can buy baby dolls have disposable income, and then Beacon can use that income and buy more medicine, right? I will make it make sense.
Yeah, you're like, I'll figure it out.
Yeah, and Mike is like, no. So I try to strategically make things make sense.
Sure.
Who can I partner with? What can we do that still aligns? Because people are struggling.
Yeah.
Struggling. And if you need medicine, you probably need food. You probably need other things. So how can I be that voice that's out here yelling? You and I were talking about a little bit earlier. What's that thing?
The megaphone.
The megaphone. Like being we'll tell that story in another episode. Be out here with the megaphone yelling, hey, let's work together. How can you do this? And what I really love, too, about leading Beacon is when I was at some of the hospital systems and I would be at tables and folks would say, Why are you here? Because they're skeptical about, why is big hospital ABC at this table? They're going to monopolize the conversation, or they're going to take my data, because we're all doing the same thing. Well, Beacon, no one else does what I do. So people welcome me to the table. Right? So I can sit at tables with different people, a diverse group of people, and talk about some of the needs and the gaps. And I always lead with data, like data-driven decision making. So when I start talking data, people listen. And then how do we work together?
One thing that I hear you keep saying in all your approaches, LaTrice, is it's this idea of, collectivity.
Yes.
I'm going to sit at the table and I'm going to listen. And I'm going to not duplicate services. I'm going to listen to the people that I serve, but I'm also going to come at it from multiple perspectives.
Yes.
Why is that so important, especially in the work that you're doing to serve this community member with multiple needs? We can't look at things as one-dimensional.
So and also I say the unpopular things.
We always need a LaTrice at the table, don't we?
I say the unpopular things.
This is important though, because you want to move forward.
Yes, and I said things I've actually had, and I'm going to get back to this next question. This is a good one. But I've actually had people after a meeting come to me and say, well, what you said makes sense, but in the future, can you call me and tell me separately? I'm like, no, I'm going to say it in front of all the stakeholders. And it's not personal. I'm not trying to be difficult. I'm not trying to be mean. But if we hide conversations, change will never come, right? So I pray to God that he always gives me humility in my delivery. Because if not, people can't receive what I'm saying because they feel attacked. And that's human. If you feel attacked, you're going to shut down.
Sure.
So I pray that God works on me so that my delivery can be one that folks can receive. But it's important for me to be at those tables with that perspective. And I think that this plays a lot. I started out in healthcare as a secretary.
Okay. Yeah.
Then I became a medical assistant. Then I became a manager. Then I became a director. Then I became a CEO, right? I grew up in healthcare. So I like to say I started at the top and now I'm at the bottom, right? Because that pyramid for me is switched because our frontline people couldn't do anything without them. But it gives me a different perspective because I'm not a leadership implant.
Okay.
I was on the front lines.
Right, that makes sense.
It's like seeing how things were happening, talking to the patients, understanding the gaps, understanding the pain points, understanding what is giving folks indigestion. So I can come to that table from a perspective of a leader, but also as a community member and a frontline person.
Yes.
I get it. I know how all the dots connect.
This is critical when we're talking about solving some of these larger issues that we all deal with as community members, right? But I don't think a lot of people come to the table, they come with their narrow perspective because it is difficult to hold multiple perspectives at one time.
It is. Bias, right? Let's talk about this. We all have bias.
Yes.
Right? And your implicit bias will trump, which is your unconscious bias, will trump your conscious bias every time because that's your go-to, right? So we need to embrace the fact that we all have bias, and that's something else. And you and I could talk about this another time, but we say, I'm not biased. Yeah, you are. We all are.
This is how it is.
And it's okay.
It's not right or wrong, just is what it is.
It just is, right? So if I don't have that frame of reference to even understand, I'm not going to think about it. And that's not bad.
Right.
It's just, it's not within, it's how it is, which is why diversity is so important. And I know that we're not supposed to talk, but I talk it and I'm never going to stop because you have to have diverse groups of people at tables because you're going to see something I don't see.
Right.
I'm going to see something you don't see, and we have to talk about it. So that's why I like being at tables, because I'm just that one that helps you just think about this from a different way. You know, I was recently in a conversation with a group that Kay Conley with the Stark County Health Department has pulled together. And we were talking about like digital wellness and some things for kids. And with cell phone use and having parents buying into not buying their kids smartphones. And I see all the good in that. And I think it's necessary kids shouldn't have phones in schools. But my lens automatically was, but what about parents of inner city kids that have now become reliant upon their kid having that phone to be able to get in touch with them?
Yeah.
Right? So we have to make sure we're talking to the parents to understand, and, you know, and then it was brought up, well, maybe just get them flip phones. Don't get them smartphones. how do you even get a flip phone anymore? Like, I don't even know. Like, if I have AT&T, I put my kid on my plan, they're going to have a smartphone. So, again, talking to people. And Kay, I love her because she says, LaTrice, that's why we have you here. Because you think of these types of things and you bring these things up. Because we just all think differently. Because I think about, I had my son a phone at 6. Because there were some trauma responses within me that I'm like, I gotta be able to get in touch with my kid. You know? So
that goes back to the individual piece. But yeah, no, that's a great story. Now, if somebody's listening to this podcast, LaTrice, and they're like, you know what, I love your mission. I want to help and be involved with Beacon. What is the best way for them to do that?
Yes. So I love this question, right? Social media. First, let me start there. Social media. We're on Facebook, Instagram, TikTok. We have YouTube and LinkedIn.
Nice.
Follow our social media platforms.
You'll know what's going on.
Like, share, and do all of that because awareness is huge. So that helps us get the word out.
Love that.
Volunteers. We cannot do the work that we do without volunteers. And think about volunteering at Beacon like volunteering at the food bank. Instead of sorting food, you're sorting medicine. So anyone can do it. You can sit down. It's not strenuous. You can bring your teenagers. You can bring your kids. So volunteer with us. Reach out to volunteer because we really need volunteers. We couldn't do what we do without our volunteers. And then monetary. Right? So like I said, we're 90% grant funded, but the majority of those grants are restricted funds, right? Which is a blessing and I'm happy for it. But we need operational funds as well. Paying the lights. You know, other utilities. I'm drawing a blank, but you all know what I mean. Running a business
we know
is
what
expensive.
You mean.
So donations are huge, and you can go to our website, and we have the ability for you to be able to make a reoccurring monthly donation, a one-time donation, and it's really important to me that you understand what your dollars could do. So there is tied to impact. So if you check out our website, you'll see the different dollar amounts that you can get and what that could do for you.
Oh, great.
So like on average, it costs about $20 to fill a script. For Beacon. You know, when we think about the cost that goes into all the supplies, overhead, and things of that nature, which is really good because the national average is much higher than that. So your donations, for every dollar you give to Beacon, we turn it into $5.71. Full transparency, our budget is about $730,000. That's what it cost us to be open every year, about $60,000 a month. So we turn that $700,000 into $4.7 million worth of impact. So it is a huge return on investment if you sow into Beacon. And then lastly, April of 2023, a House bill passed that allows community members to donate unexpired. I might have talked about this already, but I'm going to say it again. Allows community members to donate unexpired, unwanted medication. So say, for example, you have a 90-day supply of a medication because you have really good insurance. So you get a 90-day supply of this medicine. You take it and it tears up your stomach. You can't take it. It doesn't work for you. Instead of throwing it away, you can bring it to Beacon.
Oh, wow.
Yeah, you can bring it to Beacon.
I don't think you mentioned that, LaTrice.
Okay,
so that's
good.
a big deal.
Yeah, so that's huge. You can donate medication to us. So if you have, we don't take narcotics. We don't do any pain medicines. But if it's not a narcotic and it's not expired and you're not going to use it, please, please, please bring it to Beacon so that we can repurpose it and get it back into the hands of community members. And our pharmacist has a check and balance where he's able to check that medicine, make sure it is what it is, make sure it's not expired, make sure it's in good shape to get it back into community.
Well, thank you. Thank you so much.
Meg.
Is there anything that I didn't ask you that you want to share with listeners today, LaTrice?
Just want to share that, you know, the mission of Beacon is huge and the role that we play in our community is imperative. So if you are able to pour into Beacon in any way, please do so. And also spread the word that we're here so that people who need our services, one less thing that they can stress and worry about is being able to get their medicine. So help us spread the word that we are here to serve all of Northeast Ohio.
Oh. Well, thank you, LaTrice.
Thank you.
This is great.
Awesome. Thanks for joining me on Beyond the Script. If today's conversation moves you, don't keep it to yourself. Share the episode, leave a review, and tag us on social media. To learn more about Beacon Charitable Pharmacy or to support our mission, visit beaconpharmacy.org. Until next time, keep standing in the gap, serving with heart, and speaking up for health equity. Because justice isn't just a vision, it's the work we do every day.